All right, good morning, everybody. I just want to begin this meeting by going over the usual disclaimers. So this meeting is being recorded and will be posted to the HCA ESB 5476 webpage. The recording is open to public disclosure, so please do not disclose any private or confidential information. And as far as guidelines for public feedback, there will be designated time for public feedback. This says in the last 5 to 20 minutes, but actually for this meeting, we've moved it up in the agenda. There will be time for public feedback during the meeting. Each person will have 3 minutes to provide feedback. Non-committee members will remain muted except during that public feedback time. If you don't have a chance to provide feedback verbally or otherwise during the meeting, you can always submit that via email to hcaesb5476@hca.wa.gov. We'll go ahead and stop sharing that now, and we can move right into attendance, roll call. All right, so I'll go ahead and begin. Michael Langer. You here?
Present.
Great, thanks, Michael. Amber Leaders. Senator Dingra.
Good morning, everyone.
Good morning. Senator Braun. Representative Davis. Representative Griffey.
Good morning.
Good morning. Caleb Bantagreen.
Morning.
Good morning. Don Julian Saucier.
Good morning.
Good morning. Kira Fisher. Alexi Orr. Amber Daniel.
I'm here.
Hi, Amber. Brandy Flood. Vicky Lowe. Chad Enright.
I'm here.
Right. Hi, Chad. John Hayden. Sarah Melfi Klein.
Good morning.
Good morning. Sherry Candelario.
Good morning.
Good morning, Sherry. Hallie Birchinall. Teresa Atkinson.
Good morning.
Good morning. Sarah Gillard.
Good morning.
Good morning, Sarah. Donnell Tingsley.
Good morning.
Good morning. Malika Lamont.
Present.
Good morning. Addie Adwell.
Good morning. Hello.
Hi, Addie. Kevin Ballard.
Good morning.
Good morning. Hunter McKim. Kendall Simmons. Representative Taylor. Representative Musbrucker. All right. So I expect some more people will be joining us later in the meeting, but that covers it for agenda item number 1. So I will pass it over to Michael to introduce a couple new members of the SURSAC.
Okay. Thank you, Michelle. And for those of you wondering why I have my phone up, is sometimes my connection drops, so I double dip here to make sure that I stay connected with you all. I do see Amber Leaders on, and so there may be some others that have joined us after their name was called. But let's go ahead and put a check next to Amber. Welcome, Amber. And anybody else that may have joined just after your name was called? Any other members not get a chance to say hello this morning? Okay. If not, yes, welcome to our July SURSAC. And Michelle, I'm not sure you even had a chance to introduce yourself. So Michelle Martinez, if you don't know, does all of the work between meetings, 95% of the work between meetings to get us all ready. And we really appreciate all of her efforts. So thank you, Michelle, for sending out notes, sending out surveys, sending out information that people have shared. Really appreciate that. For all you committee members that have offered information that we did a call out for, please send us information on this topic or this issue or this policy. Thank you for keeping the information flow going. That's helpful as we get closer and closer to the fall and want to have some recommendations and some plan outlines and things put together. Just having that information come back and forth is really helpful. So thank you all for that. My name is Michael Langer. If I didn't get a chance to introduce myself, the Deputy Director with the Division of Behavioral Health and Recovery within the Healthcare Authority, and also the Chair of the SURSAC Committee, of which you're all participating. So thank you so much for being here. Also, Michelle, you mentioned the public comment. We're going to give this a shot. This was brought up by committee members last time. Suggestion of maybe we do the public comment early. And now I think about it, it might have been members, it may have been some of the public that was giving comment, but we heard it from the last meeting, and we're going to try it this month and we'll see if this works. If it becomes not the flow that really works for members, we can always go back and put it at the end of the meeting as well. So just wanted to be responsive for the request here in June or July. Also worth noting, as I was this morning looking at my calendar forward, our next meeting is, I think, actually on the 1st of August. So it's really quick. It's like maybe 3 weeks away. So we'll start and hopefully continue the momentum going into next month as well. Having said that, we do have, as Michelle said, we do have a couple new members. I wanted to take a moment and give them a chance to say hello. And our first member is Don Julian, is it Saucier? Don, we'll give you a chance to say hello here in a moment. And then Sarah Melfi Klein also is here with the Association of Washington Health Plans. So as we've had members need to step aside for a variety of reasons, we've gone back to those same sectors in the community and asked for recommendations forward, or actually went to those that had already applied and said, would you still be interested in coming forward? So really glad, Don and Sarah, welcome, and glad you're here. And I'll start with Don. Do you want to, as new members come on, we give them a chance to kind of just say a word about their interest in the committee and a little bit of background so we can get to know you a little bit better. So Don, are you on this morning?
Yes. Yeah.
Perfect. Go ahead and take a couple minutes, make sure I get your last name right. Looks like it's Julian. And let us know who you are a little bit more.
Okay. My name is Don Julian Saucier. I go by Julian. I am system impacted. So when I went through the federal system and I landed back in Washington where my parents were or are, in my dad's case. I have been I started out my first job when I got out was recovery service. It was a peer recovery specialist with the crisis center in Nelson 5. It was at Washington State Hospital. Before that, the mental hospital. I stayed with them, and I went into support services and became in charge of practically everything that's I'm trying to think of the word now. That's non-clinical. So I was in charge of making sure that everything was operating properly, and we were hiring people, doing scheduling and everything background with that for a number of years. Because when I was impacting the system, I was touched by yoga. I was involved as a board member with Yoga Behind Bars for a while, and I became the executive director. But during COVID, I took some losses with my first my sister and then my mother. So then it left me and my dad. I have three nieces, which is really nice. They're wonderful. But started focusing on more advocacy work. I took time to get on some committees with 1426 WELD, and also with Treatment First Washington, which became Commit to Change Washington, which is proposing decriminalizing simple drug possession. And we just did a pause of that last week, Thursday, before I got the call on Friday to consider this committee. So that was remarkable timing. I have a lot of opinions and a lot of work. I know a lot of people have been through substance use disorder, and I am an avid advocate for helping people and avoiding the criminal justice system. I should note my brother was the president of the Policemen's Guild in Seattle Police before he passed away in an auto accident in 2004. So police background, my dad was in the military. I have like a background of like strict structure, but not too strict because I, did my own thing. But I'm really looking forward to working on this group, and I'm looking forward to getting to know some of you. I have studied or listened to a lot of the videos already, and so I kind of have an idea who's who, kind of idea of the flow. But there's a lot to figure out and learn. It seems like you guys are doing a lot, and there's a lot of people involved. I've never worked in a large group like this, and I'm look forward to figuring out how this works smoothly. And I will thank you guys.
Thank you so much for being here and for listening and reading up on short order. Really appreciate that. And yes, one thing we do ask is as topics come up, there is a lot of interest on this committee's work, and there was a lot of interest to be on the committee. So please do feel comfortable actively participating and contributing and sharing your opinion. That's what this is about. So we can hear from lots of different corners of the state and folks who are representing, lived experience, outreach, treatment, recovery support, all of it. So we do want to hear from you, Leon. Thank you for being here. I'm going to move along then and ask Sarah the same thing. If you would let us know a bit about your interest in serving and a little bit about your background, that'd be awesome. So go ahead, Sarah.
Sure, yeah. Hi, I'm Sarah Melfi Klein. I use she, her pronouns. I'm a substance use disorder professional and an associate licensed mental health counselor in Washington State. In my current role, I'm the addictions administrator at Coordinated Care, one of the 5 managed care plans in Washington State. So I do a lot of training for our internal staff who's member facing, our provider network, and our systems partners on harm reduction and best practices for interacting with our community membership with substance use disorder. I also do a lot of work on our jail transition side. My treatment background is in outpatient co-occurring treatment, and I've been involved on the ops committee for some local community courts or therapeutic court programs, specifically Shoreline Community Court. So I definitely have been tracking the legislation closely, and when I found out about this opportunity, I jumped at it, and I'm really happy to be able to be here and contribute with this group of folks on implementing best practices for lower barrier, high quality care for people with SUD in the community.
Thank you, Sarah. Really appreciate you again stepping up. I know that joining something that's already underway can be a little intimidating sometimes, feel like you have to play catch up. So let us know, both of you, please let us know if we need to spend a little extra time outside. We're happy to do that, to sit down with you and give you some briefings on it and hear your thoughts. So welcome, Leon and Sarah. Thank you for both being here. I'm going to turn it back to Michelle now. Do we have someone to go over our norms and expectations this morning?
We do, yeah. Thank you to Teresa Atkinson, who confirmed she is able to do that for us. So Teresa, would you like me to pull the document up, or do you have the copy in front of you?
You don't have to tell me to unmute. I believe I have it in front of me. It's what you emailed me last week, right?
Mm-hmm. Yeah.
Okay, so committee norms and expectations. Good morning, everyone. Assume good, positive intent from everyone. Consider diversity, equity, inclusion, and tribal impacts in the work we are doing. Offer both and, as opposed to either or. Show mutual respect. Be solution focused. When identifying a barrier or systemic problem, offer ideas for potential solutions as well to inspire progress and creativity. Be fearless and willing to share innovative ideas or dissenting opinions with confidence that they will be heard. Make best effort to attend all committee meetings. When attendance isn't possible, inform the SURSAC administrator, Michelle Martinez. Did you want me to go on with conflict of interest or come back to that?
Yes, please. Yeah, we'll go
Okay.
ahead and cover the conflict of interest now as well. So just to remind everyone, this was an issue that was brought up at the last meeting. And so after consulting with legal consultants, this is the policy that we've landed on. So yeah, go ahead, Teresa.
Conflicts of interest. The Substance Use Recovery Services Advisory Committee is composed of individuals with substantial personal and professional experience with substance use, treatment, recovery services, and the various systems that impact the health and well-being of persons who use substances. At times, recommendations brought forth for consideration may carry potential for one of the members to benefit, directly or indirectly, such as recommendations that would result in state investment in programs through which committee members' employment are funded, member eligibility for direct financial gain, and/or contracts with or grants for an organization with which a member is directly involved. When a member of the SURSAC is beneficially interested directly or indirectly with the implementation of a policy, legislative change, contract funding, or any other recommendation that would be included in the Substance Use Recovery Services Plan through the approval of SURSAC Committee, or when the member accepts directly or indirectly any compensation, gratuity, or reward from any other person beneficially interested in the inclusion of that recommendation in the Substance Use Services Plan, the member shall, number one, verbally acknowledge the conflict of interest as soon as it is realized to the SURSAC and to any subcommittees involved in the development of the recommendation. 2, recuse themselves from the decision-making discussion among SURSAC regarding the specific contract, sale, lease, purchase, grant, or recommendation. 3, recuse themselves of the SURSAC vote on the recommendation. 4, refrain from attempting to influence other SURSAC members in their discussion and vote regarding the specific recommendation. The prohibition against discussion set forth in 2 above shall not prohibit the member of the SURSAC from using their general expertise to educate and provide general information on the subject area to the other members, including subcommittee members.
Thank you, Teresa. And everyone received a copy of the updated norms and expectations document, so you can review that and let us know if you have any questions whatsoever about that new policy. I think there's a hand up. Yes, Caleb, go ahead.
Hi, I do have a question. I've been out the last week, so I don't know if you've responded yet, but that's the broadest conflict of interest policy I've ever seen. And it seems to apply to virtually everybody who has any employment related to any area of this work, whether it's harm reduction, healthcare, treatment, I'm kind of, or public health, DBHR. If there's funds that could somehow flow to a public health entity or a treatment agency or any entity, that is an indirect conflict of interest. So I'm really confused by that scope of work. I literally look at our committee and it seems like 16 to 18 people wouldn't be able to vote on any of the policies if that was interpreted literally. So has there been more clarification on that?
Yes, so somewhat, yeah. So what we have talked about doing is removing the piece about indirect interest and just keeping it as, if there's beneficial interest. But it is it can be a sticky thing to define. So I'm not sure how much more time we want to spend in this meeting discussing that, but we're hearing that concern and we will go back to provide some clarification, just so we are clear about who, should be voting and who would be recusing themselves from conversation, right? Because that's the whole point of this. So I appreciate that that being brought up. Yeah, go ahead, Malika.
It also seems that the silencing of people with, you can speak according to your expertise, but if you somehow, it's so ambiguous, how do you know that where your expertise ends in y'all's perception, HCA's perception, DBHR's perception, and information that might be shared? We all have multiple layers of expertise And some of it is associated with our work, and some of it's associated with our life. Some of it's associated with, you know, the lives of our family members. So, I mean, I just don't, it seems, it is extremely broad, and I'm just wondering what the purpose of it is. When I read it, to Caleb's point, I was like, well, then I guess nobody's going to really be able to say anything, and nobody's actually going to be able to vote on anything. And the fact that we're supposed to move forward without very specific clarification is concerning to me.
Michelle, can you hear me? I'd like to address this a little bit as a chair, because I'd like to have us move on and not stymie conversation in any more than it absolutely needs to be. And so, to Malika's point, to Caleb's point, this came forward, excuse me, this came forward from the committee saying, do we have a policy? And so we did not. And so we needed to draft something, and we had to have our council look at it to make sure we were staying in good graces with what is allowed and not allowed. To myself, I want everyone to be able to speak up as much as they can. If you are running a project, a program, if you are the leader of Project X, and Project X comes up in the committee, let folks know that you're involved in Project X. If there's questions about Project X, answer questions about Project X. When it gets time to voting, I think this is the more important part, when it gets time to the voting, then at that point, I think having acknowledged already you are involved with Project X, you may need to recuse yourself if you think it can be perceived as having a conflict of interest. I think most of us are involved in these committees and projects quite often. And so we're sort of used to that. I know boards that I'm involved with, if it looks like it's in any way could be perceived as a conflict, I just recuse myself from the final vote. But certainly we want your input into the process. You're all brought to the committee because you have expertise. So I know it's a long description, and we're not going to be overzealous about monitoring necessarily, but we needed to use the words that were given, that were provided to us. And we hope there's a little bit of, self-governance in this as committee members. Just be forthright about whether you're involved in the project, and let's see how the next meeting or two goes. And if we have more issues coming up, like the indirect, if we can take that back and see if we can remove that, then we will do so. But I'd like us to move forward, acknowledging the fact that there are conflict of interest that do pop up periodically. And one way of addressing that is just acknowledging what you're involved with, which most of you have done when you introduced yourself at the beginning of the committee process. So I don't mean to downplay it, but it also could be something that takes up half our meetings for going forward. And I don't think we have the time to do that. So I think we can live within this fairly easily. Malika, I don't know if your hand's still up or it was up from before, or if you have another comment.
I put my hand back up because I feel like it not being allowed or being told that you're not allowed to speak in such a broad context is the equivalent of stop and frisk, where it's at the discretion of the leadership of HCA and DBHR, and could be used retroactively, and it definitely has a chilling effect. I understand that there were members of the group that asked for clarification on conflict of interest due to some very specific things. However, this response is so broad, and I would just like to validate your observation that you are the one saying that you would like us to move along, but it's also not going to affect you. So I feel like that is a big demonstration of the privilege of institutions to change processes mid-cycle that will impact other people. And then we're told that we're just supposed to move right along, even though all of these things could definitely impact us retroactively. So I'm just raising that for consideration. I know it's probably going to make zero impact, but I think that it's worth saying.
Okay, thank you. Other comments about the conflict of interest? We have the language now. We want it to be as flexible as possible and just have folks come forth and share their connections when appropriate. To Malika's point, I don't want to rush through it. If there are more comments, please let us know what that is. We could take things back and see if there's some adjustments to be made.
So I'll call on myself since I have the only hand raised. So I raised this issue initially because there was an appearance of a direct personal gain to be made from a recommendation. And I appreciate your being responsive and looking into this. I'm going to tell you how I'm going to interpret what you said, Michael, and see if that's helpful for others. I think I've been pretty clear about what work I do and the scope of my work. So I think when it comes time for a vote, if I choose to recuse myself, I guess I would probably note it in the chat. I can't think of an example of where I would recuse myself, given that I'm a state employee who is contracted with the state to do much of this work. I have no direct personal gain in this. So I will state that that's my personal decision-making and interpretation of that. But you know, if there's something that comes up, I will mention it, probably in a chat. I don't know how else we're going to do that with this many people. And it sounds like it may be more a process of documentation that statement's been made, that we all have to go through every single vote, all 20 people saying why they are or not recusing themselves and how much. So I guess I'm going to use my best judgment on that. I'm telling you how I'm personally going to make my decisions. And I guess if I'm going to recuse myself, my thought would be I would probably put that in the chat. But that's how I'm going to go ahead and interpret that, because there's nothing that we're talking about where I make any direct personal benefit.
Okay, maybe some examples, Caleb, will be helpful. Maybe we could put those together, but yeah, and a procedure around chat, that seems reasonable as well. So, Teresa?
Hi, I just wanted to say that, you know, the way I agree with Malika that there's such a broad intentionality behind this, that it's kind of the way it reads, it's almost as if you could interpret conflict of interest with bias, right? So as the person representing treatment providers in this meeting, I'm definitely going to have a bias around the field that I am from and what I am an expert in. And so when we go to talk about different things that are going to be solutions, I'm going to have a bias towards treatment options. That's just where I come from. That's the perspective I was asked to bring to this, which is all fair and well. But I agree also with what Caleb's saying. Like, am I going to personally benefit from any of this? You know, I think you'd have to almost be a fortune teller sometimes to think about that. The one conflict of interest that kept kind of nagging at my brain was, as a specific example, was the one when we were talking about housing, and we had housing providers making recommendations that would directly benefit their own housing program that they own and run. And I think that is maybe the conflict of interest that was coming up. And while we do need their perspective on the committees, and we do need to hear from people who are on the ground doing this work that actually understand this stuff, like if you are going to directly benefit, and I see Sherry's come up right now, so like, I don't mean this personally at all, my dear, you know, but just like, that was the one that was kind of like, oh, well, you know, so I don't know. I mean, I think it's a really, really sticky subject. But I also think that when we talk about privilege and we talk about the way privilege is going to impact this, some of us have more power in this situation than others. And there needs to be a mindfulness around how such a broad statement could not impact others as much as it would impact some.
Yep.
So, yes, I'd like to respond to that. Yes, I remember up front sharing that I had a potential conflict of interest. I also responded, I had a bias towards medically assisted treatment because that's what we do. And I also have a doctorate in pharmacology and medicine, so that is a bias. But to state that we would personally benefit, I was speaking for housing providers for a program for something we do not do, and I was very specific about that. We work with specific people coming out of prison. We do not work with people who are specifically unhoused needing immediate care. And it's a very long conversation, but I think what we all have to believe in each other is best intentions. And when I was providing my overview of this, my best intentions were for the people we serve, and we have no problem completely at Kate's House Foundation recusing ourselves from accepting funds for those two specific programs. But it has been something that has been brought up to me for years, that these people need specific help. And so if that put me in a bind with everybody, my intentions were good, and it was only for those people who need funding that we would never be able to take because we are absolutely maxed out and priced out of Seattle real estate. So, and those are my 2 cents, but please always assume best intentions because that's why we're all here and all sharing our expertise.
We will take this back based on comments we've heard. And if there's adjustments to be made, we will certainly put those out. This is not, again, meant to really stymie conversation. That was not the intent. It was intended to be responsive to the request around what is technically conflict of interest and where does it fit in the committee of our structure and things of that nature. So we'll do some additional consultation and bring it back. And thank you for those that spoke up this morning. Thank you so much. Again, I think folks have been pretty transparent, and I just encourage you to continue to do so. And that comes from passion and from the work in this field, whether you are directly involved or indirectly involved. Many of us have our fingers in many different program areas. So thank you for the comments. Michelle, are we ready? Oh, I see. Amber, you have a comment?
Oh yeah, just real quick, I wanted to say thank you to Teresa for calling out the specific thing because I really don't like it when people beat around the bush and see how much better everybody feels now that that's been called out and addressed. And I think that if we can move forward in that spirit, that would be super helpful. And I also wanted to remind everyone that I don't have the chat feature still.
Yep.
Yeah.
Thank you, Amber.
All right. And as far as moving forward, I was hearing the concern about, how we're supposed to vote and discuss later without having a resolution on this. When the actual recommendation gets brought up for discussion, if you have any kind of question about whether you would fit into this conflict of interest, that feel free to just bring that up at that point. I think we should be all right with the ones that we have for discussion today, but if there's any confusion, we can talk about it. So, all right, go ahead and move on to the next agenda item, which is public comment.
All right.
So,
good morning, folks. Blake Elson with the Healthcare Authority. We have time set aside here for public comment this morning related to anything on the agenda or otherwise. So if you have a comment to make, appreciate if you would raise your virtual hand, and remember that you have 3 minutes to make comment. So we see one hand up right away, and Lisa, please comment.
Good morning, everyone. I do want to thank HCA for moving public comment to the beginning. I probably won't be using it the way that I was suggesting in the past. Would be useful because the comment that I want to offer today is not regarding any of the items that will be voted on, but I'm sure that will be different later in the year. And I think this approach will allow for public comment to be more impactful. This morning, I just wanted to speak to the exchange of memos that's gone on between a colleague of mine on the lead National Support Bureau and the Washington Association of Drug Courts. Some of you probably have read this in detail. Some may not even know what I'm referring to, but I want to lead with an apology. The memo that the Washington Association of Drug Courts responded to was not meant to go to SURSAC. It was meant to just be essentially a bibliography that is submitted to HCA as you are gathering materials reflecting the full body of research and opinion out there about the appropriate role of the criminal legal system. And it was prepared because in an initial gathering, HCA had shared in a prior SURSAC agenda packet some data on drug court impactfulness without any other data on community-based care impactfulness. So we were solely trying to sort of fill out the remaining, the large scope of other content and opinion on the appropriate role of the criminal legal system, not in any way attempting to diminish the beneficial impact of Washington's drug courts. Lead in King County has a long and constructive history of division of labor and collaboration with King County Drug Diversion Court. So I think without the context and with that memo coming to the full committee, it looked like a debate between, drug court versus community-based care. That's not how it was intended. It was a balancing of, and also community-based care options can yield very similar impacts without some of the downsides of criminal legal system involvement, a position that I think many people involved in drug courts share, and the memo from Washington Association of Drug Courts calls that out. So I'm just here to, and I talked to Christina Mason on Friday about this, I'm here to apologize for sort of the red herring of A versus B. That's not what our memo was intended to set up, and I appreciate the constructive tone of the Washington Association of Drug Courts memo. Thank you.
Thank you. Other comments? Okay, Michelle, doesn't appear we have any other comments. Anybody want to jump in? Michael, Michelle, should we move on?
I think so. Well, if there are other comments, we certainly want to take those. And Blake, I'm not sure, again, if we took a moment to introduce your role with the group here again this month. I know for some that they might not have been here last month. So do you want to introduce yourself real quickly and the role you're playing facilitating today?
Sure, yes, thanks, Michael. My name is Blake Ellison. I work for the Healthcare Authority. I am in the Planning and Performance Division, and we do a lot of meeting facilitation and other things like this. And my role is to help us stay on task and stay on time to the best of our ability. There are things that come up, like the conversation we had, that are important, so we'll take time on that. But really, I am here just to help things move along and help us be as productive as possible. Anything else you want to share, Michael?
No, just please raise your hand if you're interested in public comment. Otherwise, we'll move along with some of the recommendations coming from the committees. Thank you for those of you who are chairing or participating in the committees. I know that can be time consuming, but also can be very rewarding. So we'll get some ideas here today shared, and then we most certainly will have conversation about possession charges going forward and what that might look like. And yeah, back to you, Blake.
All right, thank you. Last call, public comment. Okay, let's go ahead and move on to agenda item 5, recommended decision, recovery residence housing incentives and voucher system. Sarah, Alex, Brianna, do you want to chat with us about that, please?
Sarah Gillard, are you on?
Sarah, we can see you.
Yeah, I am here. Sorry, I wasn't prepared to present on this one.
Oh, that's all right. That's all right. Brianna, are you on? I know that Alex is not here today, so
Okay.
Yeah. Well, everyone has a copy of the revised recommendation. So hopefully you had a chance to review that and read that. I can go over the changes from the last time if that would be helpful. So there was the only feedback that we received, that the subcommittee received in terms of changes or requests for more information, was to include a bit more on how the tax incentive would work and how the voucher program as part of this recommendation would work as well. So some language was added in to try to clarify some of that. We did not specify an exact number for what the tax incentive would be exactly. That's one of the details that in this particular recommendation would be left to others to decide. The legislature could work out some of those details if they decide to take this recommendation. So that particular number was not decided on. But if there are any other clarifying questions about this recommendation, now is the time to ask that. And then I think we're going to move into a vote to just, to have the committee decide whether to include this in the actual substance use recovery services plan or not. And just a reminder that the committee voted to have a supermajority of 60% to move anything into the plan. So that's what we'll be working with when we get to that point. So
Michelle?
for now, yeah.
Will you please clarify? I think you said supermajority, then you said 50% or 51%.
Oh,
Is it
sorry,
supermajority
60%.
60%.
Six
Yeah.
zero. Yeah.
You.
Yeah.
Thank you.
Yeah, go ahead, Amber.
I just wanted to remind everybody that a big part of this comes out of the lack of providers and spaces for providers to operate in rural communities that are traditionally more conservative, and that's where that tax incentive thing comes from. And I believe that would have to be local consideration as far as what that would be. For the most part, I know the voucher part was more for like the more populated areas and stuff, but that tax incentive for housing owners, not just operators, because operators already get one, but for them to be willing to lease the properties that they already have to housing operators to increase the amount of recovery housing available in rural communities is something that's just so important. And that's all I'm going to say about that. Thank you.
Yeah, go ahead, Caleb.
And we have Alan.
I'm sorry.
However you'd like to. Should I go ahead for a second, Michelle?
Yeah, sure. Go ahead, Alan. Alan is on the Recovery Support Services Subcommittee, and we actually asked him to be here to comment and help to field questions about this recommendation that he was involved in developing. So yes, go ahead, Alan. Thank you.
So in the interest of full disclosure, I am a recovery residence operator in Skagit County, and also am in leadership of the Washington Alliance for Quality Recovery Residences. So that's where my perspective comes from. Just real briefly to add on to what Amber said. The real pressure that that landlords feel or property owners are feeling right now is to sell. So property values being what they are and the uncertainty of the future of that, what we're finding across the state and really led by what's happening in Oxford House, but in other contexts as well, is that people are, instead of making their homes available for recovery residences, it's a lot more and more tempting for them to sell their homes. And so the shortage that we already have is potentially getting worse. So the idea of the tax incentive is to at least put something out there that says, hey, the state is interested in you as a landlord or property owner, considering using your residence for this purpose that would help people in a really specific way. So that's the real pressure that we're fighting against, I think. And the speaking to the other issue of the basically the incentive for operators to create spaces for people who are in this sort of transitionary period. We lose a lot of people between either detox or treatment, or really between detox and treatment. That's really a really dangerous time for folks. So if we could have a bed for them, it's not a treatment bed. It really is just a placeholder, a safe place for them to be in this interim period. But there's no real funding for that, and funding tends to work on kind of a monthly basis. And so this proposal basically says if there, a week or two even could help somebody kind of bridge that gap, so they don't have to go to the street or back to their sort of toxic environment where they were. While waiting for a treatment bed. So anyway, I at the risk of overstating the case, those are the two kind of primary issues that we've been talking about.
Thank you so much, Alan. Yeah, Kayla, go ahead.
Thank you. I have a question I want to make sure I understand this. I'm obviously super supportive of housing for folks with substance use disorder. I'm just trying to understand how this is structured and also the implications for some of the other recommendations. So what I'm seeing under financial impact looks like it's just referring to existing funding. Is that correct? It's just noting that existing funding that already exists. It's not explicitly getting into how much expansion would cost. Is that correct?
Right, yeah, if it's listed under 5476 funding, that would be, wait, is that existent? I'm sorry.
There is some recommendation moving forward. We haven't spent a lot of time talking about that, but there's, so if there, as I read the chart there, it looks like there's recommendations for 23 and 24. So obviously that is not in place yet. The current funding ends at the end of fiscal year 22-23. In a couple of these categories, and there's nothing in the voucher program, and there's nothing in the tax incentive doesn't exist at present. So there's nothing there so that would, someone smarter than I am would have to do the math on what that would actually cost the state in terms of those tax reductions for folks.
I was just trying to.
I'm not sure I got to your answer.
Yeah, I mean, my understanding is the recommendations don't have to get into how much it's going to cost. It can be, we want to do this thing, go figure it out. I'm just
someone's got to figure it out.
The dollars, whether it's referencing that. So it sounds like it's not, and it's more about vouchers and tax incentives and bed holds and those types of things. Is that correct?
That would be my take from our committee's conversation. We didn't pull out the calculators, right?
And so this is really about the trying to expand some capacity, new ways to hold space. It's less about the nature, for instance, of recovery housing or supportive housing and whether you have housing models for folks who are continuing to use or not. That's not in scope. You really focus on the financial aspects of it. I'm just trying to understand the scope.
The only thing that I would say about that is that there is language that talks about those homes being accredited. And the present accreditation applies to homes that are abstinence-based, which of course excludes the use of medication-assisted treatment. So I should clarify that. Medication-assisted treatment is covered in abstinence-based housing. In other words, you can be an abstinence-based program and allow medications for opiate use disorder. So the present language talks about accreditation being listed on the state registry means that you're an abstinence-based model. So it doesn't apply to all forms of sort of self-identified recovery residents unless it's accredited. The accreditation at present requires an abstinence-based approach.
Is the committee doing anything around supportive housing for people who are using substances? I see Amber nodding, but I'm just trying to understand the scope.
Again, anyone else can jump in who's in that group, but I'll speak in the absence. So we have not spent a lot of time talking about that. We've talked about the possibilities there, but that's not been because we focused on recovery residences a little bit more narrowly defined. There's probably still conversation to be had about the rest. We also have talked some about policies that vary quite a bit in terms of if someone returns to use, what happens then. And certainly as an organization, we're encouraging people to think more deeply about that than what I would call the existing 15-minute rule, which is what you would see in say in the Oxford organization, that we need to have broader approaches. But people who are continually using drugs that need safe housing would fit under permanent supportive housing or other models aside from what we would call recovery housing. So the semantics are important here, I guess, is what I'm saying, and that's a good question.
Yeah, go ahead, Amber.
Yeah, I was gonna say, just to what Alan was saying, we did discuss that, and we had different opinions, but we didn't want to have the definition of recovery housing get mixed up with the definition of permanent supportive housing, because it's not the same thing. And we were very specific about including MAT in that definition of recovery housing. That was super important to me personally. And then the other thing was that we were talking about respite and how that would be such a good option, and this voucher program would provide respite space in already existing recovery housing. Does that kind of make sense without having to create a whole nother building for respite? And we would be able to utilize a framework that's already in place and just add another service, kind of. Does that make sense?
I mean, I'm not expert on the continuum of care around housing. I'm surprised to see Rep. Davis say that supportive housing is an outreach, engagement, and diversion and not under recovery supports. I mean, John Kelly's really clear that the majority of people in recovery continue to use, and the time to return to recovery for opioid and stimulant use is 2 to 3 years compared to less than a year for alcohol and cannabis. And it has to do with probably less about the substances and more about environmental factors. So I'm just trying to think about the broad scope of this entire committee and understand how this fits in. And I apologize for not being able to be on that committee. I would love to be on every committee, but I'm trying to think about this specific recommendation, which sounds reasonable, but I'm also curious sort of the thinking more broadly of the committee about the full scope of services around the continuum of housing for folks, because it seems pretty clear from the work that I know that I do, that most of us do, that probably housing is going to be one of the most, if not the most important thing to support a decrease in chaos, a decrease in active substance use disorder, and harms. And so it seems very, very essential and integral. And it seems like this is a chance to, think big, reimagine how we're responding to substance use disorder, and housing is so integral. And this seems an important thing, but in some ways fairly incremental and modest and not kind of transformative, if I'm understanding it. I clearly hear it's important and we need bed holds and those types of things for sure, but I'm not hearing kind of a big transformative thing around supportive housing, which I'm a little surprised about. Maybe that's happening in the OED committee.
I just want to note that we're over time for this agenda item, but I want to make sure that we hear from everybody, especially before making any decisions around this recommendation. So go ahead, Sherry, and then Malika after Sherry, go ahead.
Okay, so I'm the co-chair of the committee, and we've been housing providers for 7 years. And Walker is the accreditation body that was formed in 2018 to bring national standards to housing. It may be in our best interest to consider housing vouchers to people who are non-accredited but who pass some sort of inspection. The issue is that people who have relapsed in certain kinds of housing, specifically Oxford housing, may be asked to leave in 15 minutes for the relapse. Our foundation, Kate's House Foundation, was formed to not put people on the curb in 15 minutes. We were the first ones to do that, and the first ones to be accredited as MAT homes. So there's a lot of, as Alan described, different philosophies, but the one thing we all know is we need beds for people who have perhaps been incarcerated in jail or been picked up outside, who are currently using, they have not really specifically made the connection with care, with methadone, Suboxone, or even any type of mental health treatment. That was the rationale behind having that funding and going to existing operators who'd be willing to take people who are actively in use. And I do agree with you, Caleb, that it is a process of recovery, and we're just trying to shelter people immediately. And that discussion has been held a lot in the committee because, as you can note, we have different philosophies, and we're trying to get everybody to just state, can we come together and find a place for these people who are unhoused, who need care right now, harm reduction, and how do we best do that?
Sherry?
So I'm on that committee, and that nuance, I don't feel like it was actually articulated. I have all of the same concerns that Caleb just voiced, and I voiced them in the work group as well. And that bit of nuance that's just been shared, but also does seem to be in contradiction with the way that most of the providers that are certified under the recognized certification process that the state has. So it seems to me that there's some process things that need to be included in this recommendation about changing those certification, changing that certification so that it is explicit that there is an inclusion and recognition of the recovery process, and that it is a process. I mean, because we don't have, I mean, people say that they operate. One of the things that we've had in that conversation, in that work group as well, is a lot of conversation about how folks or operators say that they conduct their housing, and then the ways that people with lived experience have experienced those housing situations. So I just don't feel like this recommendation is strong enough. I voted to move it forward because it's something, but I am concerned that we're going to continue to, it's going to lose any potential for change, and we're just going to end up right where we used to be. It's not going to have any transformative effect. And and most of the time when people are getting ready to go to treatment, they have not stopped using drugs, and which you just brought up and recognized, Sherry. So how's that going to play into the existing operators that are certified by the state?
And if I can respond, we work directly with King County Drug Court, Christina Mason's group, and many of our clients are coming to us and they have not started treatment yet. So we are a voice in the wind. We have been for 7 years. That this is our belief system, and it's based on our experience with my own child. So I've been out of committee the last month because I had an opportunity to visit my son in France. But we have talked quite a bit, I believe, about the differences in how recovery homes operate. And I do believe in MAT. That is my bias, but I also believe in having a safe place for people to be while they're seeking treatment. And we do that. And I think more people need to be able to do that. And I think that is the point of housing, is how do we incentivize people to join us, because we cannot do any more than we're doing.
And this recommendation doesn't do that, though. That's my point. That's all I'm saying, is that I don't feel like this recommendation is doing that. And we're not talking about just in Seattle. We're talking about the rest of the state that is not as progressive as maybe what's happening in Seattle, which we are saying is also not progressive enough. You know, like, so I just want to be, that's where my hesitation comes from, is that I'm fearful that we're going to put forth this recommendation and it is not going to create, it's not going to move the needle in any real meaningful way.
Rep. Davis, go ahead.
Yeah, thank you. And I appreciate the discussion. I think I would just love to offer, I feel like we're getting into this sort of tension between two very different and equally important approaches, one of which is recovery housing, one of which is housing for individuals who are in active addiction. So people or interested in reducing their use, but still using. Both very real, gigantic, wildly underserved populations. Super important that we don't do mixed milieu, right? You can't mix those two populations in a setting for very obvious reasons, and people will tell you how triggering it is if people are using and they're on a recovery pathway. On the recovery housing side of the ledger, my understanding as to where this recommendation sits is it was never trying to solve the problems of housing for individuals, people who are actively using substances, that it was under kind of that recovery bucket. And the data that we have presently is that the demand for recovery housing in Washington state outpaces supply by a factor of 3 to 1. So this was trying to address that very real issue. Malika raised the issue around standards, and that is a very well taken point. And I'll just remind the group that the legislature passed a bill in 2019 to address that very issue, that there were huge issues with people calling themselves recovery housing operators and doing all huge, array of things that were totally inappropriate, unethical. We have now resolved that. That is why we have state standards for recovery housing. There is a ton of work that the legislature is actively engaged in, funding everything under the sun related to the rapid acquisition of single room settings like nursing homes and motels to transform into kind of what I would again bucket under outreach and engagement. So people who are coming out of encampments directly and providing them that stability so they can, maybe start to reduce their use and start to engage in services. What I'm sensing is that conversation of where do that type of housing fit maybe hasn't been had in the SURSAC. And I would offer that should have a place and should be had, but not to the detriment of recovery housing, which is a totally separate and equally important issue. So I also want to remind the group that we had a really robust conversation early on in the SURSAC regarding the huge need for transition beds and what we were calling SUD respite, which was exactly that type of situation. So somebody who is in recovery, there's a return to use, and providing them a capacity to not lose their recovery housing and get that support and then return back to their recovery housing. And I hope that robust conversation we had regarding SUD peer respite and transition beds hasn't been lost. So again, just offering that I think we should hold space to have a dialogue around the huge range of permanent supportive housing, rapid rehousing, the moteling model that we're doing in Snohomish County and King County and elsewhere. That is not recovery housing. It's totally separate and equally important.
Thank you. Go ahead, Michael.
Hey,
Yeah.
Sorry, Michelle, having some bandwidth issues here. I'll go ahead and jump back in. Michael, go ahead.
Okay. Thanks, Blake. Yeah, the fun of virtual meetings, right? Thanks for sticking with us, Blake. I feel like this calls out a need for ourselves as committee members, maybe to have a broader perspective for a moment on housing. I think Rep. Davis started to do that. There is a lot that has been invested both at the state and federally for housing for folks either interested in or fully engaged in recovery. And it feels like almost we need to have that snapshot that says, here's all the things that are happening. Because I would imagine the subcommittee and the full committee would want to continue much, if not most all of that. right? So many lives have been impacted in a positive way by the things that have happened up to this point, that I think if we think about the SURSAC plan sort of being a roadmap going forward, we'd want to share that those things are going to continue. We want Oxford Homes to continue. We want Walker's work to continue. We want supported housing to continue. And then where are the gaps and what are the missing pieces? So that's what I'm trying to sort here from the subcommittee is I don't see that this recommendation is all of that, right? That this isn't the one thing that's going to come forward in a plan forward and say this is all things housing, but this is something. This is talking about replicating the Good Works tax incentive and then also housing vouchers, which we're actually doing some of as well. So we got to kind of talk with each other. Is this, if we want to have this come forward differently, we can talk about that. But this is one component of a much larger housing portfolio that would hope we would all want to see move forward as part of the plan. I don't know if that helps or hinders, but I don't know that we don't vote on this because it doesn't include everything housing related, because certainly it doesn't. And if we want a package to come from the subcommittee, it says, give us your everything. Give us everything you want to come forward housing wise. Then we probably need to go back to committee and say, okay, now, and we can help with staff. Let's flesh out what all is and then come forward with one recommendation. But I'd love to hear thoughts from others on that.
Malika?
So to that point, that's been my concern all along, is that I didn't feel like it was broad enough. And I felt like, you know, as a policy making group, we should be uplifting the areas. I mean, of course, recognizing where work has happened, but the areas that there needs to be more work done. I'm not saying that this on its face, that this is a terrible recommendation. However, my concern is that what I have watched over many years of engaging in these processes is that becomes like the place where people focus to the detriment of being able to see that broader perspective. And what would have made me feel more comfortable as a member of this group and as a member of the subcommittee is that we're doing a broader, like we're saying this is the framework that we would like to see used. These are some specific examples of recommendations within that framework, and that there needs to be broader work, you know, to uplift these areas that haven't gotten as much investment. Not so that, I mean, because otherwise we get into this conversation of like, oh, but there is good stuff happening, and oh, well, there's this happening and there's that happening. And it's like, okay, that's great. And also to Rep Davis's point, the demand is still, you know, 3 to 1 or whatever, you know, like for every one person that's got a place, 3 people don't. So incremental change is great, but I really am hoping that this group can do more. So that's my feedback on what you just said, Michael, well, and everybody.
Thank you, Malika. Sherry, you want to go ahead and jump back in?
I did. I just wanted to thank everybody for their comments, and it's a great committee. This was meant to be incremental, Malika and group, because we saw an emergent situation of what do we do with people who are being removed from accredited recovery homes that have the 15-minute rule. How do we care for them, and how do we care for people seeking treatment? And as a person who's medically trained and a housing provider, for many of us, that felt like an emergency we wanted to address right away. But I do agree with you, we need to go bigger and broader. But if we could get this incremental suggestion, that was the impetus behind it. How do we help immediately? And with that, I will pause.
All right, thank you, Sherry. Any other comments? I see some in the chat. Here it seems like we may have a choice about whether or not we want to take a vote on this or send it back to committee for more language.
Like, I think that the process is that there is the 1 month in between for any changes for the specific recommendation. But what I am hearing is that it's this recommendation, there's more is desired from the recovery housing, the recovery services subcommittee. And so perhaps what we can do is open up some space for what else would you like to see, you know, to cover the other bases. But I think it would be, the process would mean that we move into a vote on this as it is now. But doesn't mean that this is where the work stops. But I don't think we're going back to subcommittee on this recommendation.
Okay. So I think we are, I think we have discussed it. Michelle, do you want to, as for the process, we'll get you here real quick, Caleb, take a vote. But go ahead, Caleb, go ahead and comment first, and then we'll do that.
Yeah. So I'm just putting out there what I'm hearing is, well, I understand what this recommendation is. I hear somewhat what the broader discussion is of the committee, and I can see in this additional document about committee recommendations tracking thing around all the different things that are out there. So I don't know if the sounds like perhaps this isn't possible. The way I put it out for consideration is there is this other recommendation that's listed, which I just posted around developing recovery spectrum and dedicated services and housing process aspects of recovery looks like for individuals outside of absence. Basically, you're talking about this other thing that we're also talking about. I'm wondering if as a signal to indicate that this, yes, while this is a narrow recommendation, we are mindful that there's a broader discussion needs to happen. I personally, I'm not the decision maker here, would say, do you want to add that statement here? Is that, you know, we're also working on these other things. We recognize this isn't happening in isolation. It needs to be part of a continuum. We're thinking about these other things also. Doesn't frankly tie to anything, but it is an indication, a signal that this isn't a standalone recommendation, that ultimately, hopefully, it's part of a broader discussion. So I'm putting it out for consideration. Sounds like that's not the process. Again, I think we got this on July 5. I, of course, was off last week, so I haven't seen any of it. So I'm just putting it out there for consideration as a way, maybe a way to accommodate that.
Thank you, Caleb. Michael.
Yeah, I think with the recovery support services, maybe Caleb, I'm agreeing with you on this one, is if there's been so much work going forward, if this is a component of the housing part of the recovery support services, if we could add that and say there's more coming around housing. Recovery support services covers a lot more than housing, right? We've got education and employment and transportation and childcare and all kinds of things help out with recovery support services. So eventually, I'd like to see a housing package or a housing component of the overall plan. And then, but also look at those other recovery support services they're critical as well. Caleb, if I heard you right, adding some language that this is a component of the housing recommendation that will come forward in total. And we'll also be looking for other recommendations around recovery support services. Sort of maybe request that those come forward in whole when they do come forward, so that we don't take them kind of component by component. That would be helpful.
Okay, so
right,
I think.
Thank you, Michael. Michelle.
Yeah, so I think we're ready to go ahead and vote on this particular recommendation. Doesn't mean there's not more coming from the subcommittee, of course, but just to close the loop on this one, if all of the SURSAC members could go ahead and just raise your hand so I can get a count of how many members are present today, that would be wonderful. And then we can figure out what 60% looks like. Okay. All right, I'm counting. Whoops. I'll give it just a few more seconds. Yeah, keep your hand up. Okay. I counted 18. So we will have 3 options for voting. The first will be, you can go ahead and put your hands down now. The first option will be yes, put it into the plan. or recommend it for the plan. The second will be no, don't put it in the plan, don't recommend it for the plan. And the third will be just abstaining from voting in either direction. So if you want to vote to include this recommendation in the plan, go ahead and raise your hand.
Michelle?
It looks like, yeah.
I'm sorry to interrupt here, but Caleb has a note in there, and I agree. We've talked, he and I spoke about if this is viewed as a component of something broader coming. Can we just have the chairs agree that that's what their plan is on the record so that we can then take the vote? I think that might help people vote one way or the other. So.
Yes, Caleb, I agree with you. Look.
Sure. Okay.
All right. Thanks. Keep your hands up. Okay, so the supermajority would have been 11 people, and we've got more than 11 hands. Let me just confirm for the record how many we have up. 1, 2. We got 15 yeses. All right, so hands down, please. And then any votes to, sorry, I'll wait till all hands are down. Perfect. Any votes to not include this in the plan? Just want to have your voices heard as well. All right, so we've got 1 vote to not include in the plan. All right, and hands down for that. And then if you have decided to abstain from voting at all, go ahead and put your hand up. All right, I'll wait a few more seconds here. We've got, okay. All right, 4 people have, sorry, 3. It's like 5. In the future, I'll read names just so we make sure we don't have duplications. It looks like we've got 4 people vote.
Like.
In the chat, somebody said they couldn't take their hand down.
Yeah.
Oh, Alexi, okay,
Alexi
got it, okay. So 3 people abstaining from votes. Okay. Yeah, thank you for letting us know that. All right. Great, thank you, everybody. Looks like we're adding that to the SURS plan, and more will be coming from the RSS subcommittee. All right, so that conversation took a bit longer than we had intended, and we are now at 10:20. So Michael and Blake, I believe the priority conversation for today is the criminal legal response to controlled substances. So we may want to move right into that and save the other recommendations for the following meeting. Just want to confirm that's what we want to do.
I would say yes.
That sounds fine to me, Michael.
Yep.
Okay, Michelle, you want to give a little bit of background about what we sent out, if you wouldn't mind, and then we'll get in that conversation for as far as the survey goes.
Yeah, so
thank you.
So a couple months ago, an initial document was sent based on feedback. I believe it was the May meeting, what SURSAC members wanted to know in order to help inform your position on the criminal legal response to possession of controlled substances. And so based on those requests, we put together a document that that had information available on the different aspects of those questions. And then there was a request to open up more resources from community members and fill in some of the informational gaps in that document. So then a revised version was sent. So hopefully everyone's had a chance to look at that and get the data, resources, articles, other information that you needed to help form your position on this issue. And then last week, a survey was sent out to help gauge initially where people stand. And so where we want to maybe focus our conversation today on potential policy options around the criminal legal response to possession. And the options given were to legalize possession of controlled substances, decriminalize the knowing possession of controlled substances and make it a civil penalty, punishable by fine rather than being a misdemeanor. Maintain the knowing possession as a misdemeanor, but make it punishable only by fine so that criminal protections for defendants apply, but jail time cannot be imposed. Maintain the existing legislation that to be in knowing possession of controlled substances is a misdemeanor. Change the categorization of knowing possession of controlled substances from the misdemeanor back to a felony. And then there was an option to write in other, if anyone had other ideas for policies. And we did get one other idea: decriminalize possession of controlled substances and associated paraphernalia. So it'd probably be helpful if I shared the screen so everyone can see where we turned out with the votes. There were 14 members that responded to the survey. And as you can see, the options with the most support, well, and really I should change that language. The ask was to indicate which policy options you wanted to discuss today. So these are the ones that the participants indicated willingness to discuss. So 6 members said legalize possession of controlled substances. And then hopefully you can just read the rest on yourself, but decriminalize knowing possession of controlled substances and make it a civil penalty, punishable by fine rather than being a misdemeanor. Those top 2 had 6 people each say that they wanted to discuss, but I just think it's notable there weren't any options that nobody wanted to discuss. So, you know, they're really all on the table at this point.
Michelle, can you clarify, please? It looks like there's more than 15, I think you said, of members, or 14 members responded. Mm-hmm. Did they respond with more than one option? Is that how we got to 20 rather than?
That's that's right. Yeah. Could select more than one option that you wanted to discuss.
Okay. I would just, before we start, I would just say this is a really important area that we do want to hear from everybody. And I understand people were out. I was out the end of last week myself. And so I understand not everybody may have had a chance to take the survey. But as we have this conversation, this is at the top of our list of recommendations we want to provide to the legislature this fall. And so, which means fairly soon to get it through the process. So we would like all members to engage in the conversation, please. We need to know your thoughts and where your allegiances are going forward on here so we can make our recommendation. Take it away, Blake, Michelle.
Thank you. Rep. Davis, your hand up.
Yeah, thank you so much. I just want to clarify something that I think is extremely important around language. There is a enormous chasm between legalization and decriminalization. Legalization is what we did with marijuana, where you have commercialized for-profit markets. That is what legalization is. So when we use that word legalize, that means something very specific. There are multiple ways you can decriminalize with a civil penalty, or you can decriminalize by completely removing something from the criminal code. That is not legalization. So we just need to be extremely pointed with the words that we are using. And even between decriminalization and legalization, there are options. So safe supply initiatives for people who have opioid use disorder, for example, what they're doing with diamorphine in Canada, that sits somewhere between decriminalization and legalization. But full legalization, think cannabis, right? So think commercialization of all drugs. That is what that means. So if that's what we're saying, but we just need to be super careful and intentional about wording.
All right, thank you very much for that clarification. Malika?
May I? Yeah. So actually there are there's nuance within the legalization of as well. Like there's regulation that can occur within a legalization framework. It doesn't have to be full market you know, capitalist free for all. There can also be regulation within a legalization framework. So I feel like it's not completely accurate to make it sound like there is. I mean, we have regulation within our cannabis market. Have we done the best job of that? No, I would say that we absolutely have not in Washington State, but we were also one of the first. So, you know, we still have work to do. But there's a lot of room for regulation within a legalized market. So I just want to make sure that we're not creating like a false paradigm. So I just wanted to throw that out there.
All right, thank you. Appreciate that. Okay, so we want to drive to, as Michael said, looking for to drive towards decision here on what our recommendation, should be. We sent out the survey, and you saw again those top two were the legalization and then the decriminalization. So want to go ahead and get people's thoughts about what we want to drive toward here. So we'll just open
Blake,
it up.
Would it help
Anybody want to start?
Yeah, would it help to just put them back on the screen for one, so we can keep our eye on them? And then I wonder if we just take them one at a time and get reaction so that we know where people are at.
Sure. Okay. Thanks, Michelle. While we're getting those up, I know there were some comments here in the chat. If you can see them, people may be having issues like I am today. Can't, but check those out if you can. Okay, Michelle, can folks see that? There we go. All right. So that sounds like a reasonable suggestion. We have two tied to take them one by one. We have two tied there with our in our survey at 6, and we see the first one is legalize possession of controlled substances here, and we had comments about that. Who wants to jump in on that discussion? Malika, sorry about that. I was on mute. Go ahead.
So when we say I'm just trying to get the process cleared up here. So we only had 14 respondents. We have more than that many people on the SURSAC group. So are we voting that these are going to be the places that we focus in conversation, or are we going to put that back out? Because I thought I heard Michael say that it was going to go back out to the group, and that we were also going to be and are we going to have conversations about this in the work groups, or if this is when we're voting on this today? I'm just trying to clarify.
I'll take this, Blake. I don't know if we'll get to voting today. We need to get to voting fairly soon.
Michelle, Michael.
Yeah, I will. Can you hear me, Blake?
Yeah.
Okay, I'm not sure if Blake can. So, Malika, I'm not sure we're going to put this back out. This was to get a sense of, are we at a place that we can start having the conversation? What I suggested is I wasn't in at the end of last week. Of course, I had the opportunity to see these beforehand. Not everybody did. If there are other options once we talk through each of these that people want to put on the table. I think we're still open to that. But we do have to come to a place of voting, if not today, probably in 3 weeks or whenever we get together on that 1st of August, in order to get this processed in time to get our recommendation in. So where it says legalized possession of controlled substances being the first one, we heard Rep. Davis give fair warning about, language matters here. We should make note of that legalized possession in the legislative language is much different than decriminalization. So I think whatever questions you have, whatever advocacy you want to make, for the first one, we want to hear those now, because we are going to vote, whether today or in 3 weeks, or, and we want to make sure everybody is of the same understanding of what these are about and what cautionary tales you want to give for them or how you want to promote them. But although we didn't get all members responding in the survey, anyone who's on the phone, all of you that are on the phone, I hope you really take an opportunity to weigh in on each of these right now. Ask what questions you have, get clarification, because we do need to vote. And I want to make sure everybody understands what they're voting on. So that's why I'm out here today. So, Blake.
So I do have another comment to make then in that vein. So legalization is the only way that we're going to get to a place of having a regulated, safer drug supply, where we will actually be able to meaningfully address the poisoning crisis that we find ourselves in, that is resulting in overdoses. That is the only framework with which we will get to a place where we can really meaningfully address that. Decriminalization will do absolutely nothing with the illicit supply. The prohibition-based system is what has created the current poisoning crisis that we are in right now. So that is, that's something for thought. And legalization does not have to mean a whole entire free-for-all. Absolutely, we should probably not have that. That is one of the things that we have learned through the prescription opioid epidemic. That's something that I hope we kind of learned, but I don't think that we have. But a regulated, legal, safe supply is going to be how we get to a place where we can actually start addressing overdose in a meaningful way and start making meaningful investments in helping people get the help that they need, because they're not going to have to sneak around and hide, and in order to avoid prosecution. Decriminalization will not get you to a safer supply.
All right. Thank you, Malika. Appreciate that. We have Hunter.
Hey, good morning. See, I 100% agree with what Malika just said. Also, is my volume all good?
Yeah, we can hear you just fine. Thank you.
Perfect. Yeah, I was just wondering, because I'm outside. Yeah, what I was saying is that I 100% agree with what Malika said. I was kind of split between the legalization of possession as well as the decriminalized part. I think I'm more towards the legalization. I think I'd repeat everything Malika said. I think the safe supply is really important. And kind of where that comes from is I know people who have innocently, like, whether it's experimentation or they've been using or they've taken something that's contaminated and either landed in the hospital or not survived it. So I really think that the safe supply is important. Also see what Caleb said, that he proposes decriminalization with no penalty. I was kind of thinking something similar before we had the discussion where we were distinguishing the legalization and the decriminalization. One thing I was thinking, well, I am leaning more towards legalization. I was wondering if we could add on the part where it says decriminalize knowing possession of controlled substances and make it a civil penalty, punishable by fine rather than being a misdemeanor. I was thinking maybe we could add like a fine or community service if we did go the route of decriminalizing. But I do still think that legalizing would be the closest thing to a solution. That's all I have for that.
All right. Thank you, Hunter. Appreciate that. Amber.
So what I want to say is, to the point that we have another policy coming up for review, which I have to leave in 15 minutes because I have labs today and I didn't realize that. So I'm not going to be around to really get to discuss that because we're so over time. But testing supplies are being able to be able to test the supply is so important also. And with current paraphernalia laws being what they are, fentanyl test strips are not widely available, and people can't take their drugs in and see what's in them. So I don't think that giving the government the power to regulate what drugs are on the street is smart. They've been putting drugs on the street for a long time, or letting it happen. And I don't see the benefit in giving the power to the government of regulating that. Seeing what they've done with marijuana and what they've done with opioids, I am in favor of decriminalizing possession and paraphernalia, including testing supplies, and that's why. Also, I want to say that since I won't be here to vote on these policies, I am for all of them. If you could count my vote, since I can't put anything in the chat.
Amber, we
All
won't
right,
get to
thank
those
you.
today, so don't worry about that part.
Yeah. Just want to read a couple of comments in the chat too. I think that a fine creates an administrative burden and doesn't add benefits. And then another comment, current paraphernalia laws, as I think that we alluded to here, also hindered the ability to for harm reduction programs to expand services and connect with folks who do not inject. So with that, Chad, we'll go to you.
Thanks. I guess let me see if I can maybe narrow down some of these as best I can. So I started off as working as a public defender, and I've been a prosecutor for roughly the last 15 years. The misdemeanor options, the second, third, fourth options, and civil penalties, those really aren't practical. And you might as well just put those in as decriminalization. And that's sort of, I think, where we are to a large extent right now. Very few jurisdictions are prosecuting drug possession right now because as a misdemeanor, we just don't have the resources to prosecute misdemeanors. Drug offenses, we've got to send these drugs to the crime lab to be tested in order for us to prove our case. A misdemeanor is so low priority for the crime lab, it could take months, if not years, to get results back on a misdemeanor. So that's really not an option. I think the options, go big or go home. Legalize or it's a felony. I think if we want the criminal justice system to still be involved to some extent, you make it a felony. You can make the first two offenses a law enforcement diversion. You can make the third a prosecutor-led diversion. You can make the fourth an unranked felony. But I don't think a civil fine, I don't think misdemeanors are really practical solutions. They're not going to be enforced. So we might as well just call those options decriminalization, because that's effectively what I think they're going to be.
All right, thank you. Appreciate that. Just want to note that Caleb also put a link to it looks like an article that talks about decrim versus legalization. So check that out, Malika.
So I just have a couple of things that I want to respond to as far as like so the notion that the quote unquote government is going to determine like the purity of drugs or not. I mean, science is what looks at is what determines what a chemical compound is. And frankly, I would rather have more science on the side rather than having it determined by the illicit market that you know, so that we have smaller, you know, amounts, but yet more potent substances that we don't know what they are and we don't know what's in, you don't know the measurements, you don't have any idea of what's in something that a person is taking. And that's why and that's why people are being poisoned in record numbers. And I also I would just like the group to think about, you know, when we say that we assume that the system is apolitical, and that meaning the criminal legal system is apolitical, and that that it's not implemented in ways that are disproportional, or I mean, we're lying to ourselves. Like the people that continue to have disproportionate impacts are marginalized people, Black and brown people, poor people. And so, I mean, I don't feel comfortable saying, oh, we just have, you know, in effect, decriminalization if we continue to keep, you know, if without explicitly saying that we are going to legalize, or that we are going to, you know, we make a concrete statement about what we're doing. I do not believe in because we have reams of evidence that show us that our systems are not blind. Justice is not blind in our country. I would argue we don't have it.
Thank you. Appreciate that. Just want to note before we get on to Addie that that Rep Davis did put a graphic in the chat too, if you can see the chat. Interesting. So Addie, go ahead.
Hi, thanks. I just wanted to say that I really agree with what Malika is bringing up right now, especially around, you know, prosecutors are mostly not charging these cases, but the mostly isn't good enough if it's selectively being applied. We know that selectively lands on people who are the most marginalized. And I also just want to say I support the legalized possession of controlled substances and paraphernalia for all of the reasons that have been mentioned, but particularly around safer supply and addressing the drug poisoning crisis. I also think these types of civil penalties or fines or things that we think of as sort of lower stakes than felonies, they still have stakes for the individuals that they're landing on and can really create a lot of havoc in people's lives that are already pretty difficult related to, you know, all the things that people have going on. So I think if we think these things are going to be incentives or helpful for people or meaningful consequences, we really need to like really look at that before we move forward to it and understand all of the implications of those things.
All right. Thank you, Addie. Appreciate that. Julian.
Yeah, I agree with a lot of things that are being said, and like to Malika's point about legalize versus decriminalize. I'd like to see more information on decriminalize and the comparisons between the two. I know that in our work group with Commit to Change, we landed on decriminalize primarily because it's more acceptable to the community. And the intention was to eventually have no penalties, just have no forced interaction, but you know, have more stuff available in the community to get people to help, you know, and make it readily available, low barriers services so that people can get find treatment on their own before they have to deal with the legal system in any way at an earlier stage. But I think just what my experience, I believe that would have been a better outcome for me. Also, I can't see what's in the chat. I'd like to make sure we can get those, whatever's in there, sent to us if that's possible. And that's all I have right now.
I'll include comments from the chat in the meeting notes, just for those of you that don't have the chat access.
All right, thank you. Thanks, Julian. Thanks, Michelle. All right, Rep. Griffey.
Yeah, thank you, everyone. Great conversation. I think it's, from my perspective, and it comes from professional firefighter perspective, and I know you've all heard me make comments that if we change the law too quickly without putting the services in, we all need to know that a lot more people are going to die. And from my perspective, I just want people to stop people from dying. And any way we can get there is, I think, good. But I want to echo or say that what I think the prosecutor Chad, I think his name was Chad, was saying. I think he has a nuanced approach. Keep it a felony, have 3 diversions, and then on the 3rd one, you say put them in a program, a mandatory program, and then when they complete the mandatory program, that any negative legal consequences that could follow that individual the rest of their lives would then just be erased from their record. I just think that we just have to get really serious about what we're seeing. Giving Narcan, the opioid antagonist drug, was something we did in the early 90s a lot. And then we stopped giving it for almost 20 years. We're giving it several times a day with maybe twice a month, a death or near death, very near death, where there is grave disabilities. This is very serious. And I don't know that legalization and the government regulating a legal drug that is going to kill people, even if we regulate it, even if we make it legal, it will still kill people. With the potency, even with the government on it, is still going to be very tough to figure out. I don't think the government should endorse these terrible drugs that will kill people. So that's what I got, and I think that was a nuanced approach. Thank you so much for your time.
Thank you. Okay, more comments on this subject? Malika, go ahead.
In the month that marks 5 years since a person that was my first child passed away. She wasn't my biological kid, but she was my kid from an overdose. And a young woman that died down the street from an overdose this weekend. And a giant in our movement who passed away this weekend. This isn't just some theoretical conversation, so I just want to make that real clear. When people know what they're putting in their bodies, when they don't have to hide, when they're not, to underestimate and depoliticize, de-emphasize the impact that prohibition has on the poisoning epidemic that we are facing in this country. Incarceration does not improve outcomes when it comes to overdose. We have lots and lots and lots of evidence that demonstrates that people are actually more likely to die when they exit incarceration and treatment if they lapse. When we continue to have an unregulated, illegal drug supply, it will not fix all of the problems. And that is not what I'm saying. We have many reasons why people use substances in ways that maybe are not healthy for them. But by far, we have reams of evidence that demonstrate for us that prohibition is one of the main reasons why it is so deadly. And the traumas, you can't erase what a possession charge does when people's kids get taken away and all the trauma that has been enacted on people as a result of our prohibition-based laws, the families that have been separated, the generational trauma that has been experienced. And then when people die, I mean, the ACEs that have occurred, we know that people that experience substance use disorder have a ACEs score exponentially higher than the general population. So I resent the implication that was just made that somehow these are just things that we're just saying, and that we don't have, there's not some real like lived experience attached to it. And I am not negating your experience as a first responder. You most certainly have seen, and you live in an area that has been disproportionately impacted, and that I have served many of the same people that live in your area. And I've worked to bring programs that will help save people's lives. So I don't want this to come across as an attack. And I don't want it to be just dismissed as passionate either. These are real questions, and we owe this topic the real consideration of like not just saying that business as usual is going to create the change that we need. It's not.
All right, thank you, Malika. There's a lot of comments in the chat, if you can see those. Appreciate that. Julian.
Yeah, I have to really agree with what Malika said. In my case, there's a long period of time where I wanted to seek help but was afraid to go and get it for being incarcerated. I didn't know where to go for help. That is the legalization barrier, going for felonies and all that, and going through the courts is just changing. You're not dealing with the trauma that you've been dealt in life. You're dealing with the trauma of being incarcerated and going to prison and all the challenges of fighting your case and losing everything. You're not dealing with the root causes. And I believe that we have to really focus on services that deal with root causes, not the criminal legal system, which clearly has not worked for the last 50 years. All it's done is created more deaths, more people incarcerated, more family destruction. It's been a colossal failure. And I hate, I know that the heart of people that are in this work are working hard to save lives. Everyone has the same overall intent, but really understanding like where individuals who have been affected are coming from needs to be, placed at a high priority, because you have to you have to understand that it's safe to go somewhere for help. You have to understand that it's and even just information about the signs, like, am I getting into trouble? Is this, because it starts out as fun. There's all these people, there's tons of people using drugs that are never affected by any system whatsoever. It just impacts other people more because they get deeper into the shadows eventually. That don't have the resources or the supports that other people have. I'm just really want to make sure that there's an easy way for people to get help, that there's a way to get to harm reduction and safe supply as a path. I also realize that it's hard for people to understand overall, like in a broader community, as far as getting things passed and done, like what all those impacts are. But as close as we can get to not having another barrier for people to succeed and not disrupt lives would be amazing, in my opinion. Thank you.
Thank you, Julian. We are approaching time here. We'll take, I think we have time for one, Michelle, maybe two comments to see that if they're quick, that would be appreciated. So Vicki, why don't you go ahead?
Vicki, if you're speaking, you're muted.
Thank you. Vicki, you there? All right, Chad, let's jump to Chad.
Yeah, I was just going to add, I agree that the criminal justice system has a really bad history of being able to work with substance use and really applying the law in a way that is not equitable. However, I think that if this committee makes a recommendation of legalization, I think that's some of the legislators here may disagree with me, but I think that's dead on arrival at the legislature. I don't know that goes anywhere. And so I guess my thought is, can this committee get creative with the criminal justice system? Can we find a way for the criminal justice system to do it different? Yes, we've done it in the past. We've done it very poorly in the past. What can we do to try to change that system, that criminal justice system? Otherwise, my fear is we're going to send this to the legislature. The legislature is going to say, nope, we're not going to legalize. And then the legislature is going to craft a criminal legal response. And we're going to regret that we didn't have more input on that criminal legal response. It's perhaps a compromise, but that's my fear, is that we're gonna present something that's not going to go anywhere, and then the legislature is going to craft something that we're going to really wish we had more input on.
All right, thank you. Appreciate that. Vicki, we have about 30 seconds. Vicki, can you hear us? See your hands up? Okay, must be having
Can you
some
hear me
technical
now?
difficulties.
Yes.
I can,
yes,
yeah.
okay.
We have about 30 seconds. Thank you.
Okay. I just want to really support what Malika and the others have said about the focus on drugs being criminal and how devastating this is. You don't just punish the person, you punish a whole family, and not just for one generation, but for many generations. And I think we just need to, be careful about stigma and make sure that we're really, we have an opportunity to do something really great here and really focus on helping people and helping them get the services they need. And I think if we can set aside stigma and really focus on that, this is going to be a really great thing. But I'm worried that it's, the drugs have been so conflated with the legal justice system for so long that I know it's a big ask, but please, if people could just set aside the ideas about drug addiction, drug use being illegal, and think about what, people don't use, I've said this before, people don't use drugs because they haven't been incarcerated enough or they didn't pay enough money in fines. They have reasons that they're used, and we should be focusing on and addressing those. Thank you.
Thank you. Michelle, sorry to kick it over 1 minute, but we are near the end.
Yeah, thanks so much, everybody. It does sound like, I think this is clear. We're not ready to vote on this yet. So in terms of next steps, I'll send out meeting notes as usual, and we can review the conversation that was had today. Please let me know if there's any other materials or ways that we could frame the next conversation that would help out, or perhaps it's just a matter of, having a bit more time to review what's already been provided. And I think that's all for now. Michael, do you want to make some closing comments?
Yeah, thank you. And thanks everybody for your input. I think at this point, having heard what we did, maybe we can trim our options down to 2 or 3, and then start this off in 3 weeks at the August meeting. For those of you that come forward from the subcommittee, please keep doing your work. Think about what we did today and how you can put it in sort of bigger packages. We can kind of look at things all together, but I think we're going to need to get through this piece before we get on to more of the plan work. And so hopefully we can get that done at our next meeting. And if we need to use the entire 2 hours to do it, that's probably what we need to do in order to get this recommendation in. And thank you for the honest feedback. For those that haven't had a chance to speak up yet, we still want to hear from you as well. And we'll get this out maybe early, within a week or so, Michelle. Maybe we can get out the options so that people have a little more time to think them through before we come back on early August. So with that, I just want to thank you, Senator Dinger, if you're still on. If you want to say a goodbye to folks or a closing word, you're welcome to. Otherwise, we'll adjourn. She may have had to step away. Okay. Thanks everybody. Thanks, Michelle. Thanks, Blake. Thanks everybody for contributing today. We'll see you in about 3 weeks. Take care.